Hi everyone, welcome back to my channel. So it's your speech language pathologist Akshara. So today we are going to discuss about how to make a voice therapy toolkit. I just want to see the light. I just want to see the light. So as a speech language pathologist, we all see daily a number of voice patients. So as in my caseload, I see almost 2 to 3 patients a day as working in a hospital setup. So I'm going to discuss what are the various voice therapy treatment resources should be kept in a clinic or the hospital setup in order to help those patients. So let us discuss what are the therapy resources that I personally use in my voice therapy toolkit, and if you have any other recommendations, please. So pehla step, the first and foremost step is to make the patient understand about its disorder and the mechanics of voice production. पेशेंट को क्या डिसऑर्डर है और उसका क्या इफेक्ट पड़ रहा है, कैसे इफेक्ट पड़ रहा है वॉइस पे, वो समझाना पेशेंट को सबसे ज़्यादा ज़रूरी है. एंड इट इज़ द फर्स्ट एंड foremost स्टेप ऑफ द वॉइस थेरेपी प्रोग्राम. So let me show you what I use to educate my patients about the voice therapy disorders. So these are the various printables that I will add the link of the description below. So I made them by myself, and they have different printables about the various disorders like vocal nodules, normal voice production, then we have sulcus vocalis, and various types of voice disorders that we have. So it is really useful in making the patient understand about the type of disorder he or she is having, and what is leading to the what is leading to the hoarseness in the voice or breathiness in the voice. So by this we can it makes us very easy to make them understand, if we do not have their laryngeal examination reports. Pyrometer that I use basically क्योंकि कुछ पेशेंट्स में we see because of the faulty breathing pattern and due to inadequate subglottal pressure, we see a very weak and a very weak voice. So in order to assist with them, so I use this pyrometer, and it is very cheap, and we can buy it from Amazon or Blinkit, and it's easily accessible. So the patient has to blow it and inhale it, whether it depends upon whether we have to increase their expiratory muscle strength or inspiratory muscle strength training. Although there is another device we use in our practice that is a bit expensive, so I usually don't have that and usually recommend to some of the patients. However, I will link it in the description below. Next we have is various types of straws that you can see. Oops. I have these types of straws, as you can see. Different length, different breadth, different types, and like this. So I use these straws for semi-occluded voice therapy and straw phonation. So हम in इस type of therapy में we generally use different types of straws. हम पहले मोटे वाले straws से शुरू करते हैं, धीरे धीरे we move on to the thinner straws. I usually recommend patients to use these steel straws at the higher stages of voice therapy, as these are reusable, and to avoid the wastage of straws, because we have to use the straws again and again in our therapy program. So better to use these reusable straws, and it comes with the cleaner that you can use to clean these straws. So for a long term, these straws are really very beneficial for using that for straw phonation. Then in my voice therapy toolkit, I have tissues, a lot of tissues. So I use tissues for stretch and flow phonation for the way your voice therapy toolkit. Next I have a very important thing that I personally use as a speech language pathologist. So I personally use the steamer with myself as well as a speech language pathologist. So this steamer consists of various, so in this you have to fill the water, and this is the bucket. And the most interesting part of the steamer is this. So you can just put it your mouth over here, and you can have steam inhalation directly through your vocal cords, through your nose. So it is the most, interesting part of the steamer. So that is really helpful in order. So you have to keep the steamer for yourself as well, and it is really helpful to guide the patients. Like we usually recommend, okay, I'm advising you for the steam inhalation, but how to do it to provide maximum benefit to the vocal cords is only that you have to demonstrate the patient correctly. So in your practice, you should have it for the demonstration as well, and you can use it yourself for your vocal hygiene. So next I have the cups, paper cups. I really have the cups of different sizes. So I generally recommend using the bigger cups for the patients having at an advanced level, although I use the like smaller cups for the initial level. So what I do, I fill the water in the cups and ask the patient for the straw phonation. Next I have a golden tool that we mostly use is the mirror. So it is a handy mirror that you can keep on the table, and we use it basically to guide the patients in order to give them the feedback about whether there is a tension in the neck muscles or not, whether their breathing pattern is clavicular or abdominal, whether their shoulders are moving when they are breathing or not. So we use this mirror obviously in my therapy toolkit. So next, the most important thing is this. That is the voice therapy booklet that I have created using resources from different resources, articles, and different websites. So basically the major portion of this book has been taken from the bone voice and what all patients I can use it in. For example, let me show you. So there is a technique I'll show you. So as you can see, there is written that respiration training. So the baseline is the kind of problems that you can use it in. For example, respiration training can be used with the aspects of the approach, the steps of the approach. As you can see, 1, 2, 3, the steps of the approach, and what kind of a patient and the case history while using this approach. So yes, it's a very useful resource, and you can use a description email in the comment box, and I will share this booklet with you. Also, I am having different resources as well about the expiratory muscle strength training, vocal hygiene do's and don'ts that I usually give to patients having hyperfunctional voice disorders like vocal nodules, vocal abuse. So वो sheet भी handover हमें करना होता है to the patient. So I have a separate, a whole bundle do's and don'ts while you are following a voice therapy pattern. So yes, we have all of this in my voice therapy toolkit. So if you have any other suggestion, any other tool that I accommodate in my voice therapy toolkit, then do suggest. My comments are always open for suggestions. So if you like my video, please like, share and subscribe my channel. Thank you. Signing off. I just wanna see